Welcome to Dr. Peter Imoisi YouTube channel. If you've not subscribed to my channel just yet, please do ensure you click on the subscribe button below. So I would like to address the question of the possibility of reinfection of the SARS-CoV-2 virus, and also should you maintain social distancing or physical distancing after being treated for the COVID-19 disease. So for the SARS-CoV-2 virus, basically is a novel virus, and there's little known about this particular strain of coronavirus. So when it comes to the possibility of reinfection, we are neither here nor there, because there are instances where people have reported reinfection of this particular disease. But again, when you go through the route of immunology, you should expect that when an individual is infected with a particular pathogen, he or she should be able to build antibody for subsequent reinfection. But if I'm to take a clue from the already known coronaviruses, because before this particular strain of coronavirus, there are other coronaviruses before now. An example of such is the Middle East respiratory syndrome coronavirus, and also you have the initial SARS-CoV-1, which is severe acute respiratory syndrome coronavirus 1. So these are the two known previous coronaviruses before now. Now for these two strains of coronavirus, we know that you develop immune system that could last you for 12 to 24 months before you could get reinfected. Now for the other four coronaviruses before these other two I mentioned, the level of your antibody that is within the circulation is really low, and there are reports that says that within 2 to 4 or 5 months or even weeks, the antibodies, say for instance IgG or IgM, they kind of fade out really quick. Now looking at these two scenarios and trying to equate this to the current strain we have, which is the SARS-CoV-2 virus, we do not really know exactly what to expect. So should you then maintain social distance or physical distancing? I would say yes, because we're not so sure of the real behavioral pattern of this particular virus we have currently. It is novel, and I will advise people, despite you've tested negative from the initial positive test you had after going through the series of treatment and isolation center, I will advise you still maintain social distancing or physical distancing, as it were, and also you ensure that you adhere to the guidelines as rolled out by the NCDC. Now, the other question I would like to just address quickly is the myths going around that SARS-CoV-2 virus could be transmitted via a mosquito bite. I think for this particular question, there is no evidence, there is no data to support the fact that you could get infected from a mosquito bite if an individual has the virus in his or her system. So basically there's no evidence to that. And if you want to take a clue again from other known viruses, say for instance HIV, there is no evidence that says that HIV could be transmitted from a mosquito bite. So they are more like the same virus, but this is an RNA virus anyway. So basically there's no evidence out there that supports that. Thank you.